Hi, this is Michael Hexter. Welcome to Politics 2100, my video cast here on YouTube. So this episode I'm calling American quote-unquote hypercapitalism weakens public health and the fight against COVID-19. So this is a commentary on a couple different events, including the CDC weakening its quarantine recommendations, shortening the time that people should quarantine after being testing positive for COVID-19, and also the general, we have, for instance, the mayor of New York agitating against remote work. This is the new mayor, this is Eric Adams, and in general, we have signs that public health authorities and governments are waving the white flag in the face of the onslaught of COVID-19 and Omicron, the surging Omicron variant, which is causing cases to skyrocket here in the United States. There is some speculation that Omicron is milder than Delta and then other than the wild type virus. So in terms of its potential for lethality and for severe illness, this has not yet been proven. And but basically what we're seeing is public health authorities gambling, and not just public health authorities but government authorities. So really the public health push is, there are public health authorities, but they cannot act on their own and enforce their own rule making, or at least recommendation making, because that's really what they do in most cases. So anyway, we have basically a huge gamble with the lives of children, with the lives of teachers, with the lives of all kinds of workers and their families. So really the entire nation, a huge gamble regarding whether this Omicron surge will cause mass death, and it's already causing some increase in death. So it's not like the common cold. It's not. It's still a dangerous virus, and we just don't know exactly how dangerous Omicron is. But in this environment, though, the premature surrender to Omicron, or to the not just to Omicron, but just in general, is a symptom of what I'm calling here hypercapitalism. So this is a concept, I don't think it's original with me, but it's an easy concept to absorb and certainly to formulate, and it's not the meaning of. I'm just using maybe a new term for something that. American-style capitalism, which is basically a preference for low regulation and a thin social safety net, or no social safety net at all, and this is there are strains in American policy making and American politics that are not hyper-capitalist, but in general there is the relative to other some other nations, developed nations, America is relatively hyper-capitalist in this way. In that, and anyway, the pandemic really puts on display the strength or weakness of what's called the social democratic impulses, and therefore the ability to manage society as not just a market, but as a place to live, as a place to lead, to govern society, not just manage, but govern society, which I would associate with the word social democratic governance. Okay, and in the United States, so hypercapitalism and the social democratic impulses are at war with each other. Okay, and the anyway, so what the pandemic does is it or what are concerned about getting ill, and therefore and the likelihood of getting ill from catching the COVID, you know, not only inhaling the virus, but then becoming sick from it, is that we are held back from engaging in commerce in various kinds of interaction with other people. Now, this is something personally I am not. I'm tired of isolating. I'm tired of wearing a mask outside or in public buildings and so forth and so on. And on the other hand, whatever my personal preferences, I see the need for governments to regulate contact between people until we have the pandemic entirely under control. And we don't have it under control at all. In fact, it's run out of control again. So anyway, the resistance to having government manage society and therefore public health initiatives require a government to impose rules and or at least certainly strong recommendations, if not rules. And if there is a great deal of support in the government for public health, also with incentives, with various or new institution building, like testing centers or quarantine centers, or at least leasing hotels or whatever that are to become quarantine centers. So in a sense, not necessarily a permanent institution building, but all that requires funding and money to do that. So, and I'm not recommending right now that necessarily that's the priority of a public health initiatives that should be happening now. Those things that I see as being the most important are the rollout of vaccination and testing, contact tracing where possible, and also enabling remote schooling and remote work, and not pushing either students or teachers or workers to engage in commerce because they're being starved or forced by the lack of social supports or the lack of guidance from government to hold off for a few weeks or whatever it will take to withstand the current surge in cases. And so basically the governments are gambling with, or are again, that Omicron is going to be mild, and that also that the damages that will happen are tolerable. Okay, and this is where American hypercapitalism devalues health. It makes health a thing that or health care and health insurance something that is negotiated on the market, that's potentially an area of profit for corporations. And so that's one example of this hyper-capitalist approach to to our lives, in some sense, that we are at least people between below the age of 65 are required to find some way to get insured and to pay for health care at a higher rate, at twice the expense or maybe even 3 times the expense of other developed countries. So because some companies want to continue to make very high profit margins on drugs and hospitals and so forth and so on, and want to manage their affairs in a way that is not as regulated as it might be in some other countries. So the hypercapitalism is this devaluation of our lives and our welfare, okay, and and particularly troublingly children, okay, the lives of children, because we're seeing a higher incidence of hospitalization and death among young people in this newer surge, or in the last a month or so, or a couple of months of the pandemic. So that this is not basically, that government officials do not place a high value, and therefore to use fancy terms from ethics and meta-ethics, a deontological, that they have a deontological duty to protect life, and that they're and that is the primary duty, and that has priority over the impulse to make money. And so and that somehow government then, if a government has that as a higher priority and enacts that, they would also need to support people, for instance, who lost income, or below a certain level, because of which happened in parts of the pandemic, and here and in other countries. But basically the authorities, or the government leadership, the Biden administration, and are simply just they're waving the white flag, okay, and they are not asserting, they are not particularly strong in this area of a deontological or a duty-bound approach to governing, and they are more in the sort of let's look and see and test the winds, okay, and see how this fits with the interests of capital, the interests of big donors, okay, and how very powerful interest groups that have strong lobbies in Washington, and this sort of let's test the winds, okay, rather than put down a line in the sand and say this is what we're going to defend in terms of the rights of people in our country to life, liberty, and the pursuit of happiness. And so the hyper-capitalist approach is then more, there's more gambling with people's lives, and there's more, and you are encouraged also to gamble with your own life. You're encouraged to go out there and see, well, maybe you won't get sick, okay, maybe you won't infect someone else, okay, and so anyway, this approach is something that I'm gonna be talking about in other videos, and I think the word hypercapitalism has a good, or especially when associated with American, creates a good framework, because I think we need to differentiate between different types of capitalism. That we have the term socialism now, and socialism is used often, and it's a fine ideal. I don't identify myself as a socialist. I used to for many years, and I'm not anti-socialist, but I think that the capitalism socialism sort of duality needs to be made more complicated in talking about social democracy, or a strong mixed economy, and then the word hypercapitalism basically being the absence of, there is a mixed economy even in our hyper-capitalist society, but the cultural impulses, the values, so forth and so on, are tend toward let's gamble with, let's see what fortune will provide, and let's not come down with a rule that says you shouldn't do this, you shouldn't do that, or you should do this and you shouldn't do that. And that doesn't it doesn't make sense to totally rely on chance and fortune. Okay. Now again, let me just reiterate, personally, I am personally tired of the pandemic. I'm personally wanting to go out and interact with people freely, and I'm trying to do that as much as possible within the limits of my risk tolerance and my sense of how to protect myself and protect other people from possible infection for me. But again, we need government to lead, and also even more so. And this is another area which I don't think I mentioned earlier. The government needs to press for an international, vaccine program that where the patents are lifted on the main vaccines, or they are somehow the production of generic vaccines needs to be encouraged in many countries, this is probably the most important single thing that governments could be doing right now to stop the cycle, basically now, the cycle of COVID or a coronavirus, novel coronavirus associated with sudden acute respiratory syndrome, SARS-CoV-2, we're calling it. But anyway, this cycle of variant production to slow it or to nip it in the bud will require a massive vaccine program that we don't have and that we have not been pressing for. And so there's a lot of justice, international justice that needs to be done in the area of health justice, and it's in all our best interests. The only downside is for the companies and the private companies that currently have the most popular vaccines, and then other companies who are trying to get into this market and also want to protect whatever patent they have on their vaccines. And so we see very starkly the clash between people, or between the ethical commitment to particular principles and the profit motive, okay, in pharmaceuticals, and in the vaccines being one kind of pharmaceutical. And so this will require it requires us overcoming, I think, our commitment to hypercapitalism. It requires us to commit to a form of a social democracy. I mean, again, I'm using words that people don't necessarily use, but it requires a commitment to living and to human life and to human flourishing that trumps, I'm sorry to use that word, or that as priority over, or that is a higher level than the impulse to acquire things and to trade things and to try to greed, basically, or acquisitiveness, let's say, to try to that's as sort of a neutral term to describe the impulse of profit seeking. Okay. And anyway, and this requires a change in our attitudes, and a change in government policy, and a change in how we discuss what's considered practical, what's considered feasible. Okay, and it requires us to not surrender to this hypercapitalism, this profit motive over everything else, and corporate rule over everything else. So, another component of this is that corporations currently own our government in some ways, or at least the corporate rule is very, very, very well ensconced in the U.S. government. So that's and that's not necessarily that's not at all a free market capitalism at all. It's a corporate capitalism. It's a crony capitalism. But it's still a corporate rule, okay, and based on the profit motive of a very few. So anyway, so if you thought this was an interesting video, please like it, and please share your comments on the range of topics in the video in the comment section, and also please subscribe to Politics 2100, and I will see you in the next video.